Once you have the heart on the ultrasound screen, it is best to increase or decrease the depth until the heart fills the ultrasound screen from the top of the screen to the bottom of the screen. By doing this, you reduce artifact from the lungs and other structures of the thorax and concentrate the computer capacity to imaging the structure you want to study. Image quality will depend on the frequency of the transducer. The transducer frequency you choose will depend on the depth of the image you wish to see. The heart in cats and small dogs will be at relatively shallow depths, allowing the choice of high frequencies. Many ultrasound machines have a variable frequency transducer in the range of 5 to 8 MHz or 6 to 10 MHz. You would probably choose 7.5 to 8 MHz to view the cardiac image in cats or small dogs. The shallower the depth, the higher the frequency you can choose, and the better the cardiac image should be. My guideline is that the smaller transducer with the higher frequency can be used on cats and small dogs less than 40 pounds in body weight. For dogs greater than 40 pounds in body weight, I recommend the lower frequency transducer. Many lower frequency cardiac transducers have a variable frequency from 1 to 5 MHz. The higher frequency will give a better cardiac image, and the lower frequencies are better for color flow and spectral Doppler images. Gain may also be known as power. Gain knobs control the signal strength or power of the transducer. Too much gain produces a white, distorted image. Too little gain produces a weak signal. Some ultrasound machines have TGC toggles or time gain compensation toggles to help control gain. Each toggle controls gain at a specific depth. Gain is decreased at that depth by pushing the toggle to the left, and increased by pushing the toggle to the right. The topmost toggle controls depth in the near field or the part of the screen closest to the ultrasound transducer. As the beam travels from the top of the screen towards the bottom, it takes a little more time and power to reach increasing depth. In general, each TGC toggle must be a little farther to the right than the one above it to produce an even gain appearance across the ultrasound screen. The goal is to obtain a cardiac image which shows anechoic chambers filled with blood and clearly defined muscle walls. Once the TGC toggles have been set, the overall gain knob can be used to increase or decrease gain, affecting the entire ultrasound screen. Some ultrasound machines do not have TGC toggles and instead use 3 gain knobs. One knob controls gain in the upper or near field of the ultrasound screen. A second knob controls gain in the lower or far field of the ultrasound screen. And the third knob controls overall gain. In abdominal ultrasound, each TGC toggle is a little further to the right than one above it for most organs. This is based on an assumption that tissue density and echogenicity will be the same from the top of the screen to the bottom of the screen. In cardiac ultrasound, echogenicity is not the same. Cardiac muscle is hypoechoic or dark. The endocardium is hyperechoic or bright white. The ventricular chambers are filled with blood and should be anechoic or pure black. Anechoic means no ultrasound return or no echogenicity. Because of the various echogenicities, there is often artifact in the cardiac chambers. Use the TGC toggle in the area of the right ventricle or the near field to reduce gain and artifact. Then use the TGC toggle in the area of the left ventricle or far field to reduce gain and artifact in that area. This gives you a better cardiac image. Focal points are used to improve image quality at certain areas of the ultrasound screen. Some ultrasound machines require the operator to set and place the number of focal points desired for every image. The operator should constantly adjust the focal point or points to the area of interest on the ultrasound screen. The operator must also choose the number of focal points to use. Some ultrasound machines offer from 4 to as many as 12 focal points. As the number of focal points in use increases, the frame rate of the ultrasound machine decreases, causing a slow motion image with increased motion artifact. In general, it is best to set 1 or 2 focal points. Some ultrasound machines automatically control the number and position of focal points for you as you increase and decrease depth.